Hi, I'm Faisal Rahman. I'm an interventional and structural cardiologist at Johns Hopkins. That means I treat patients with heart problems that often have blockages of the blood vessels of the heart, problems with the heart valves that can be narrowed heart valves or leaky heart valves. So that's aortic stenosis or aortic regurgitation, as well as mitral stenosis and mitral regurgitation. I also treat patients with adult congenital problems such as atrial septal defects, patent foramen ovalis, and other similar problems as well. So technological advancements in cardiovascular medicine has really given us the opportunity to treat patients in a very minimally invasive approach. What used to be previously treated with heart surgery, now we can do minimally invasively. For example, aortic stenosis can be treated with transcatheter aortic valve implantation, which is a technique where we go in through the blood vessels in the groin without any cuts and are able to discharge the patients often within 1 to 2 days of their procedure, which previously under surgery would require 5 to 7 days of staying in the hospital. Similarly, if patients with a history of stroke who have congenital abnormalities such as a patent foramen ovale, we can treat that minimally invasively to close that hole between the different chambers of the heart. And finally, patients with blockages of the blood vessels of the heart, we can put in intravascular stents to open up the blockages to help improve the blood flow to their heart. My research interests are in patient outcomes and quality improvement. So that means I look at processes in the healthcare system to see where patients are not getting the best care possible and try to figure out how we as the multidisciplinary team in healthcare can improve the patient outcomes so that whenever they encounter or are sick in the hospital, that we can try to give them the best results possible. I work with patients who are the sickest of sick in the cardiology intensive care unit to patients that I see in the outpatient clinic and really work to see how we can really improve patient outcomes in that scenario. One example is patients in cardiogenic shock. We've recently initiated the cardiogenic shock team at Hopkins, focusing on making sure patients get quick, expedited, excellent care to cardiogenic shock, which is often a very complicated condition with poor outcomes in lots of patients across the country. And we've really demonstrated a significant improvement in survival as a result of that approach. My patient philosophy focuses on two main items: good communication and good patient outcomes. Communication is exceptionally important between the patient and myself, so we can think about all the options and come up with the best option for that specific patient. But we also want to communicate with their providers, their cardiologists, their primary care providers that they've known for many years and trust. And we try to make sure that the entire multidisciplinary team comes together and communicates well to come up with the best results possible for the patients with the cardiovascular problem. If you or your family member have any cardiovascular problem that might benefit from these minimally invasive approaches to treatment, we look forward to seeing you in clinic and discussing the options that may be available so that we can help you get back to where you want to be.